PEG, polyethylene glycol, with electrolyte is a medication used to clear out the intestines before certain bowel exam procedures like colonoscopy or barium enema X-rays. It acts as a laxative by drawing large amounts of water into the colon, resulting in watery bowel movements. This helps to clear stool from the intestines, allowing your doctor to better examine them during the procedure. It is important to take the prescribed dosage of Golytely as directed by your doctor, usually starting the day before your scheduled procedure. Make sure to drink plenty of clear liquids while taking Golytely to stay hydrated. Some brands of this product come with a medication guide. If available, read the medication guide provided by your pharmacist before you start taking this product. If you have any questions, ask your doctor or pharmacist. Follow any special diet instructions provided by your doctor. Do not eat solid food, usually starting on the day before your procedure until after your procedure. This product must be mixed with water as directed before use. Carefully read and follow all directions to mix this product. After mixing, place the container in the refrigerator. Chilling the mixed liquid will improve its taste. This product may cause certain liquid thickeners, starch-based products, to not work well, which may increase the risk of choking. If you are using liquid thickeners with this product, talk to your pharmacist to select a liquid thickener which will not interact with this product. The dosage is based on your medical condition, procedure, and response to treatment. Drink the mixture by mouth as directed by your doctor. It is best to drink the mixed liquid quickly instead of sipping slowly. The mixture may also be given through a nose-to-stomach, nasogastric, tube. Follow the specific directions given by your doctor for when and how much to drink. Be sure to finish drinking the amount directed by your doctor. Watery bowel movements usually begin within 1 hour after you start to drink the mixed liquid. Drink plenty of clear liquids as directed by your doctor to prevent becoming dehydrated. Avoid taking other medications by mouth within 1 hour before you start taking this product. Doing so may make the other medication work less well. Ask your doctor or pharmacist if you are not sure when to take your other medications. It is important to note that nausea, bloating, or feelings of fullness in the stomach/abdomen are common side effects of Golytely 236 gram, 22.74 gram, 6.74 gram, 5.86 gram oral solution. However, stomach/abdominal cramps, vomiting, and anal irritation occur less frequently. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. If you experience any serious side effects, such as severe or persistent stomach/abdominal pain, bloody vomit, chest pain, fainting, fast/irregular heartbeat, sudden shortness of breath, bloody stools, rectal bleeding, seizure, or signs of kidney problems, it is crucial to contact your doctor immediately. While it is rare, a very serious allergic reaction to this drug may occur. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help right away. This is not an exhaustive list of potential side effects. If you experience any other effects not listed here, it is important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report side effects to Health Canada at 1-866-234-2345. Before taking Golytely, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to any of the ingredients in the solution. It's important to discuss any medical history, such as stomach or intestinal problems, trouble swallowing, heart issues, kidney problems, seizure disorder, or mineral imbalances. If you are planning to have surgery, let your doctor or dentist know about all the medications and products you are using. For children, it's important to be aware that they may be more sensitive to the side effects of Golytely, especially dehydration. Room temperature solution is better for infants. Children under 2 years old may be more likely to develop low blood sugar if they haven't eaten. If you notice symptoms of low blood sugar in your child, such as shakiness, unusual sleepiness, or prolonged crying, seek medical help immediately. If you are pregnant, Golytely should only be used if clearly needed, so it's important to discuss the risks and benefits with your doctor. Additionally, it's unknown if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. Now let's talk about how to use Golytely 236 Gram-22.74 Gram-6.74 Gram-5.86 Gram oral solution. It's important to be aware of any potential drug interactions, as they could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial to follow your doctor's approval when it comes to starting, stopping, or changing the dosage of any medicines. Always consult with your healthcare provider before making any changes. And remember, the best time to take this medication and the daily dosage will be determined by your doctor based on your specific needs. If you suspect an overdose or experience severe symptoms such as losing consciousness or difficulty breathing, seek immediate medical help by calling 911 or your local poison control center. In the U.S., you can contact the Poison Control Center at 1-800-222-1222, and in Canada, you can call your provincial Poison Control Center for assistance. This medication should not be shared with others. It is for your personal use only. In today's video, we will be talking about Golytely 236 Gram-22.74 Gram-6.74 Gram-5.86 Gram oral solution. This medication is used to clean out the colon before a colonoscopy. It is a laxative that works by causing diarrhea to clean out the colon. It is important to follow the dosing schedule provided by your doctor in order to get the best results. Typically, this medication is taken as a split dose, with the first half of the dose taken the evening before the procedure and the second half taken on the morning of the procedure. It is important to drink plenty of clear liquids while taking this medication to prevent dehydration. Be sure to talk to your doctor about the best timing for taking this medication and any other concerns you may have. When it comes to storing Golytely 236 Gram-22.74 Gram-6.74 Gram-5.86 Gram oral solution, it's important to follow the instructions on the product package or ask your pharmacist for guidance. Make sure to keep this medication out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into the drain unless specifically instructed to do so. Instead, properly discard it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.